So one of the key challenges for patient safety is the workload of the NHS and the amount of challenge that staff have getting through the day. So being able then to take the time that they need to be able to learn about patient safety and or reflect on the care that they're giving is quite difficult for them. So I think that's one of the challenges, is the busyness of the work environment of today.
And how important do you think it is that the NHS now has a patient safety strategy?
I think the strategy for the NHS is going to be key. It's really important to have a single point of focus around our direction of travel for patient safety, and the strategy gives us that. But it's broader than the NHS, because this is going to inform social care, the wider system, but it's also an international issue. And we know that we've this year had World Patient Safety Day. So patient safety is an international issue. And I think this allows us to be able to talk on an international scale. So training, education and development are really important, both in terms of setting some knowledge and standards for people to understand. So it's about a minimum understanding of what patient safety is, as well as higher level competencies for those who are in more safety critical roles. But along with that comes a single language for the NHS, everyone knowing what is meant by patient safety, what safety means for them in their roles. And I think the other thing education can help with is improving the culture of patient safety. So education doesn't change the culture. No individual intervention is going to change the culture. But what it does do is it helps strengthen a patient safety culture, and it gives people permission to be able to talk to patient safety as being an issue for them and for the wider system. So I think one of the key things about the syllabus is indeed that it is consistent throughout. So it's going to clearly be very different at different levels of role that people are in the NHS. Not everybody needs to understand patient safety to the same degree, at the same level of competence or knowledge. But if everyone has the same introductory understanding, the same benchmark against which we can say, at least we understand what we mean by this language, that's really important. And also then, for those who are understanding patient safety at a much higher level, having a consistent syllabus will improve transferability of skills across the NHS. Patient safety is not the same as clinical safety. It's not about the interventions. Everybody has a role in patient safety. And if we take an example of perhaps a commissioner buying a service or buying a product for the NHS, if they don't understand the impact that their purchase decisions they make has on patient safety through the system, that's really going to be a gap. And likewise, people perhaps are making financial decisions in the boardroom. If they do not understand the impact those decisions have on patient safety, then that will be a detriment. So I think there's a role for everyone, from the non-executive directors through clinical staff to support and admin staff, and even those staff who are remote from the NHS but in support services. It's really important we're all speaking the same language. Well, I think it's really important that we try and open a dialogue about what we mean by patient safety and what we can do. So part of the event we're having today is about talking to the regulators about the syllabus and what that means for them, and starting to make those connections. But this is something we want everybody talking about. So we're going to be using webinars and other training mechanism to be able to make people aware and open a dialogue. And also training institutions are going to start to develop curricula based on this syllabus. And I think that's a really important place to be having conversations about what should be in that curriculum that helps us achieve this overall strategy.